what about the Hippocratic Oath? And how do we stop the CDC and doctors from doing this?
This is a great question, which is not just related to vaccines, but also related to the transgender issues that we've been facing, these bodily mutilation surgeries that doctors have been committing against youth, right? So the Hippocratic Oath, the thesis of it is the doctor swears an oath to first do no harm. The doctor is sworn to only help people. And I think we see that a lot of doctors, whether they are committing abortions, whether they are chemically castrating young boys who have gender disorders, whether they are removing, I apologize for being graphic here, but I'm trying to just state the facts, whether they're removing the healthy breasts and the healthy uteruses of young girls who have fallen prey to rapid onset gender dysphoria, this contagion effect. I think we see that doctors have violated this in a significant way. In fact, the Hippocratic Oath is not actually taken by doctors anymore. It's simply an old school tradition, and I would strongly advocate that we return to it. We won't be able to return to it until we address the corruption of big pharma, because doctors are, and medical providers, it's not just doctors, medical providers are governed by organizations, governing organizations like the American Medical Association or the American Academy of Pediatrics. There's a professional organization that specializes in every specialty. These organizations set what's called the standard of care. The standard of care might have a good intention. Let's make sure that everyone understands best practices. Let's make sure care is consistent across the board, not just good in one state and not good in another state. It has good intentions, perhaps. I'll allow that. But what it's become is it's become a danger to patients, because a doctor is no longer allowed to use his or her judgment when treating a patient, because if the doctor deviates even one iota from this standard of care, then they are liable if they have a bad outcome with that patient. So if you go to the doctor and you say, okay, I understand that you're recommending XYZ treatment, but doc, what do you think? Like, what is your clinical gestalt is what they call it. What do you feel I should do? They won't answer that question. They'll just say, well, the American Academy of Pediatrics recommends XYZ. The CDC recommends XYZ. The reason that they do that is because they're afraid if they deviate even an inch from what these professional organizations say, that they will be sued. If they're sued for malpractice, they're done. They're done financially, they're done professionally. And so what we have to do in order to reform doctors' behavior is we have to reform these professional organizations. We have to sever the control that these professional organizations have over doctors and nurses. And the first step to that, because they are ostensibly non-political organizations, the first step to that is to expose the corruption, to expose the fact that the American Academy of Pediatrics, which if you go to a pediatrician, everything they tell you, everything they recommend is dictated by the American Academy of Pediatrics. But did you know, as your parents take you to the doctor, maybe for your yearly checkup, that same doctor that's telling you, yeah, this is what I would do for a sinus infection, this is what I would do for a UTI, this is what I would do for this mental health issue that you're struggling with, they also will tell you, yeah, you should get the COVID vaccine. And yeah, if you have gender dysphoria, you should undergo hormone therapy and surgery. And also, you shouldn't have guns in the house because our organization thinks that we should ban AR-15s. We have to expose the partisan, corrupt, and unscientific ideology of these organizations before it's going to trickle down to doctors. The radical left has an incredibly strong hold on medical schools as well. There are billionaires in our country, radical leftist billionaires, who fund medical research universities where these standards of care are developed. And these radical leftist billionaires are, like George Soros is one of them, I don't want to be vague here. And the governor of Illinois, J.B. Pritzker, his brother, who transed and identifies as a woman, is another one of those billionaires. They fund these medical schools so that they can help set the agenda that determines the standard of care. So there's politics and money, of course, from Big Pharma. Big Pharma makes a ton of money from transitions, makes a ton of money from, the opioid crisis. We have to expose the radical leftist ideology that controls these things in order for people to understand that when they talk to their doctor or their medical provider or their public health official, that that's not actually someone that can be implicitly and blindly trusted, that what they're saying to you is them repeating what they've been told by a rabidly partisan organization. And if there's a silver lining to COVID, it is that people's eyes have been opened to this corruption. People are starting to understand that they have to think for themselves. They have to question what they're being told, and sometimes they have to say no. So if we don't have this awakening of the people that demands that this cartel, if you will, be dismantled, then we're never going to be able to play whack-a-mole with the individual problems as quickly as new individual problems pop up.